Oh, yeah, sure. It's a great question. Systematic reviews has been consistent reporting that the COVID-19 infections during pregnancies was associated with increased risk of preterm birth, low birth weight, stillbirth, NICU admissions, and preeclampsia. And severe COVID infections further exacerbate all these risks. Yet the evidence regarding other perinatal outcomes, such as small for gestational age, breastfeeding initiation, is still exploratory. And many of those studies primarily focus on the negative impacts of this infection and often fail to distinguish the direct effects of the COVID infections with the broader pandemic-related factors. So during pandemic, we know many pandemic-related changes such as unemployment, income instability, financial stress, and limited access to healthcare may have affected pregnancy outcome as well. So our studies is to address in the gap by examining the association between COVID infections, including severity, timing, and pregnancy exposure to the pandemic, and adverse pregnancy outcomes using South Carolina statewide Lincoln database, including all the births delivered in South Carolina from January 2018 to December 2021. Sure. Yeah. So what we find is the influence of the exposure to pandemic on preterm birth, low birth weight varied over time. So we define the exposure to pandemic into three groups. First is a group of women who never exposed to pandemic. That means they conceived and delivered the baby before March 1st of 2020. And some women who partially exposed are those women who conceived before pandemic but delivered on or during the pandemic. And the last group is a fully exposed group. That means they conceived and delivered after pandemic start. So compared to people with the pre-pandemic group, the partial overlapping group, the partially exposed groups, representing the early pandemic months, was associated with decreased risk of preterm birth and low birth weight. However, the preterm birth and low birth weight prevalence was much higher for those who fully exposed to a pandemic compared to pre-pandemic group. And pandemic group is also experienced increased NICU admissions, reduced breastfeeding initiations at birth. Consistent with other literature, we find the SARS-CoV-2 infections during pregnancies increased NICU admissions, but did not affect other outcomes. Also, pregnant women with moderate or severe COVID infections were more likely to have preterm birth than those who don't have any infection. And then finally, we find maternal COVID infections in the third trimester increase the risk of both preterm birth and low birth weight and NICU admissions. So that's the key results we find. Oh, sure. Thank you. It's a great question. So I think in our results, number one, it contributes to literature by showing pandemic exposure to pandemic self is independent effect pregnancy outcomes, irrespective of the COVID infections. Regarding COVID infections, we find that this moderate severe COVID infections, third trimester infections is more important. So therefore, our results indicate, the importance of considering both COVID infections and the pandemic-related factors such as job loss, mitigation measures, and the healthcare disruptions in optimizing the perinatal outcomes.